Welcome to our presentation today on SLPs and BCBAs. How do we make collaboration work? My name is Lynn Dudek. I am a speech-language pathologist, and I am currently the speech-language pathology manager with Step by Step Academy here in Columbus, Ohio. I also have a small private practice, ASD SLP. I've been a speech pathologist for 20 years now, and almost all of that time I've specialized in the treatment of individuals with autism. Done quite a bit of presenting. It's one of the things that I love about our field. So welcome all of you to our presentation. So SLPs, BCBAs, why do we need to have this discussion? Why do we need to talk about collaboration? What is the important part about collaboration? Well, every child with autism is going to have two things that we need to work on. We're going to need to work on their functional communication, and we're going to need to work on their behavioral concerns. So from that standpoint, the two fields are set up for collaboration. Like I said, have been a speech pathologist for 20 years. I also completed my coursework to become a BCBA, and I will be sitting for the exam in January. So luckily, I have kind of an interesting viewpoint of the two fields, been in one a long time, and learning about one rather quickly. So from the BCBA task list, and all of our BCBAs in the audience will be very, very familiar with this. A BCBA is directed to practice within one's limit of professional competence in applied behavioral analysis and obtain consultation, supervision, and training or make referrals as necessary. And in very plain, simple language, what that means is we as BCBAs can do what we can do within the scope of our practice, and we're going to talk really in-depthly about the scope of practice for both fields in a little bit. But we can do very well what's within the scope of our practice, but then we are required by our credentialing body to make those consultations, to make those referrals, and to find other experts to bring in on cases. In the very same language, or the very same idea, but a little different language, speech pathologists are directed to do the same thing through ASHA, the American Speech, Language, and Hearing Association. And what ASHA tells us is that as speech pathologists, individuals shall use every resource, including referral when appropriate, to ensure that high-quality services are provided, or that service is provided. Again, in simple English, we have to find the best people who can help our consumers the best, the quickest, and with the most efficient use of resources. And that may mean referral to a behavior analyst. This entire presentation and the idea to talk about the collaboration between speech pathologists and BCBAs came out of a question that I and a colleague received several months ago from a presentation that we were doing on communication. And she called us and said, hey, you know what? I'm having a really hard time collaborating with my colleague. And so what we had to do is do a little bit of research and have really good, honest discussions about what does an SLP do? What does a BCBA do? And talk a lot about collaboration. Collaboration requires a commitment on the part of every single person involved. Just because you throw a bunch of people in a room together does not mean that collaboration will automatically happen. We need to go into the relationship with a collaborative mindset. Collaboration demands careful attention to communication skills. And we as speech pathologists sometimes think that we kind of corner the market on collaboration skills. Unfortunately, this is not true. We as speech pathologists know a lot about the bones of communication. We still have to make sure that we are practicing effective listening and active listening. And the same thing is true of our colleagues who are BCBAs. Collaboration obliges participants to maintain parity throughout their interactions. We have to keep the bigger picture in mind. We've all been in those meetings where one of our colleagues is just ready to go to war over an idea, and in the grand scheme of things, it is not that important. We have to keep the big picture in mind, and the big picture is the consumer that we're serving.